Hello everyone, welcome to my YouTube channel. Once again, we'll be looking at laboratory quality, and I've tried to lay a foundation on laboratory quality. So if you've not watched my video on the laboratory quality, please you can see the link there and watch the video. Okay. Now, when we are looking at the laboratory quality, I ended it by saying that one of the core element of quality management system is laboratory audit. Okay, such as maybe internal laboratory audit, and that is what we are going to be looking at further. Once again, my name is Dr. Emmanuel Ogbodo. I've been working in the UK as a specialty biomedical scientist, and I'm also a lecturer in biomedical science here in the United Kingdom. So now, let's get into it. What is audit? I know I've made a video about this audit before, but I really want to expand it more. So if you've not watched my previous video on audit, you can actually see the link up there and then watch it. Let me say this. Now, when you look at laboratory audit, what exactly does it mean? It's just a form of assessment anyway, like I've said in my previous video. But when you look at the laboratory audit, you are looking at examination of current policy or practice against a defined criteria. Let me tell us what I mean by defined criteria. When we talk about the defined criteria, we're looking at the standard, we're looking at the ISO laboratory standard and so on, okay? Because that very laboratory has to be within conformance. The only way it can be within the conformance if it is functioning according to requirement of ISO laboratory standard. So that's the criteria, that is the defined criteria. Therefore, when you are assessing an individual or when you are doing an assessment or examination of a current policy or practice against a defined criteria, which means as stated in the ISO laboratory standard, okay, criteria or policy, that is then called audit. Therefore, criteria that is being measured could then be either internal or external. So now, when you look at the quality manual, we'll mention a lot of things that will be in that very quality manual. Therefore, all those documented manuals in the laboratory, are where the quality and policies are being stated. You see, so now, and that means that is a defined criteria for whatever thing that is going on inside that very laboratory. Therefore, when you are assessing someone or you are examining a policy or practice against that very documented information on your quality manual, okay, that is then internal audit. And of course, when there's a criteria that is being assessed with what is happening, what is documented outside the laboratory, when the laboratory is being assessed against a criteria outside the laboratory, is then called external laboratory audit. Now, what do I mean by that? With the internal, it is very easy to look at. Now, with the external, you are looking at something like maybe UCAS laboratory assessment, or each of those individual countries, accreditation bodies or regulatory agencies, okay, that see that the laboratory in their countries are within standard. But once again, here in the UK is UCAS. So these UCAS, they have a criteria. The same way there is a quality manual inside the laboratory, there's also a quality manual in the UCAS. So UCAS have a quality manual of what is expected of the laboratory. You see it now. And that quality manual of the UCAS also reflects the ISO laboratory standard. The same way the quality manual inside the laboratory also reflects the ISO laboratory standard, and of course UCAS laboratory standard. Does that make sense? So now, when UCAS assess the laboratory against its own criteria of what is in the quality manual, that is then called external laboratory audit. I hope that makes sense. So I'm trying to define that very criteria, and that's why I said that the criteria can be either internal or external. I want you to know that when we look at external audit or internal audit, now that we've known the difference, the subtypes of the audit remain the same, but the difference is where is occurring. Is the audit happening inside the laboratory? Is the laboratory assessing its own activities? If the laboratory is assessing its own internal activities to see whether it is within conformance, that is internal audit. However, when the laboratory is then being assessed against external documented requirements, that is then called external audit. Now, having known this, why do we do audit? There's a lot of things that make audit important, but I'm going to try to stay focused and highlight this. So audit is important because it will then confirm and determine that the laboratory is functioning according to the requirement as stated by ISO laboratory. So meaning audit is to ensure and to determine that the laboratory are functioning, as required, as stated by ISO laboratory standard. Now, also, can I also mention something that, when we look at something like in the United Kingdom, you look at the UCAS, and when you look at UCAS, that is an overall laboratory accreditation body, but there are also other regulatory bodies, like when I talk about MHRA in blood bank. If you've not watched my video MHRA, you can watch it. I'm also going to put the link there. So the MHRA is also a form of regulatory body, is also a form of accreditation body, but they also work in accordance with the UCAS. I hope that makes sense. So in other words, in ensuring that the laboratory meets up with the requirements in terms of the audit, when you look at the internal audit or when you look at the audit, in ensuring that the laboratory maintain the requirement, it goes not just as stated in the ISO laboratory standard, also with their local regulatory bodies, okay, such as maybe for us in the UK, you look at the UCAS, you look at MHRA, and of course, it also shows you whether the activities going on in the laboratory are within conformance as stated in the standard operating procedure, which is the SOP. You see why this is important? Now, with the help of the audit, you can be able to check the effectiveness of the new procedure. When there's a new procedure in the laboratory, many people may not be acquainted to it, many people may not be familiar with it, but with the help of the audit, you can determine whether it is effective, has people gotten used to it, and also whether it is working or not. Remember, from the audit, we can make some changes, we can review the document and edit some of the information. So audit help us to see where we are doing well, where we are not doing well, and see what we can do to improve. So in other words, like I've said, with the help of the audit, you can be able to effectively check or determine whether your new procedure or processes is effective or not. And of course, audits help you to continue to improve, because in doing that, once you see that's where you are not improving, you can be able to review that and then make an improvement. In fact, I think that one of the things that is most important with the audit is provide room for improvement. Now, audit also can help to provide insight on the current practices. In other words, when you do audit, especially when there's a new procedure or something like that, with the help of that audit, you can provide more insight about that very new policy or new practice or new procedure that has been put in place in the laboratory. Audit is not just about the bad thing as well. Audit can also review and show good practice. In other words, it can show you where most of the staff are doing well, or maybe where further training might be required for some staff. So it will show you where the laboratory is doing well or not. Audit will identify if there's any risk in any of the method, because part of the audit also is that the person you are auditing, okay, the person that is undergoing the audit can also recommend what he or she thinks it can be a risk of a particular procedure or method. Let me give you an example. The method has been optimized and has been stated to be used. The management or the Bank 7 have come up with this very standard operating procedure, and they are telling you to do it like this or do it like this. They've told you there is a documentation on how you should work. Now you are competent. When you start working, you start seeing the shortcoming of that very policy. You see it now, of that documented policy. During your audit, you can actually recommend what you think about that very procedure and how you think it can be able to improve. You see it now, very important. Which then mean that audit can identify risk. Then another one is that audit identify where there is a non-conformance within the system. And of course, once it's identified, someone can be retrained as the case may be. And what is also very important is that with the help of audit, we can actually prevent non-compliance or non-conformance. In other words, when you audit a member of staff, you can decide maybe from the outcome of that audit, correct that, tell the member of staff, wherever that member of staff is non-conformance or non-compliance, you can actually retrain that very member of staff, or maybe educate that very staff more. That way, that will not repeat itself again. Therefore, audit can help to prevent non-compliance. Now, talking about this very audit, which obviously has to be to see that the staff or the activities going on in the laboratory, meet up with the requirement of the ISO laboratory standard. What exactly do ISO laboratory standards say? what is their recommendation regarding maybe in terms of evaluation and audit to see that the laboratory are within conformance. One of the things that they require is that you have to demonstrate that your pre-analytical, your analytical and post-analytical processes are within conformance, that there is a standard at each of these very levels. That is one of the things that ISO laboratory standard stated. You also need to ensure that your quality management system are within conformance. That means there has to be a regulation to show, to make sure that the quality management system will continue to maintain standard as requirement of the ISO laboratory standard. ISO laboratory standard, also recommend that there should be a periodic review of the quality manual. That way you can be able to see what that you might need to include, what you might need to remove. The whole idea is to continue to improve on the quality system of that very laboratory. What is also important, like I've mentioned about the staff giving a feedback of what I can improve on the standard operating procedure or a particular procedure in the laboratory. In fact, even the service users like the patient, they can actually give feedback of the service that they use. One of the things that ISO laboratory standard, say or mention or highlighted is that we should be able to take feedback both from the staff and also from the service users. And this feedback should be taken to be able to periodically review our quality manual to see how we can be able to continue to improve. Why is audit important as a requirement of ISO laboratory standard? It is important because these are the recommendation from the ISO laboratory standard. Their requirement is that there should be audit, and the same benefit of the audit that has been highlighted in that internal quality laboratory manuals is also what is documented in the ISO laboratory manual, that if you're going to run a lab, there should be an audit to see that this like we've already highlighted take place, to prevent maybe non-conformance, to make sure there's going to be a continual improvement and all of that. And of course, the ISO laboratory standard also stated that every activity that is going on, whether it is at the pre-analytical or post-analytical, at every phase, pre-analytical, analytical, post-analytical, they are within conformance as required by ISO laboratory standard. So you can see that obviously what we have said in the internal audit is what we've also said about this ISO laboratory standard. What it then suggests is that everything that is going on either in the internal quality manual or the external quality manual, when you talk about the UCAS, all of them reflect to the ISO laboratory standard. It's the ISO laboratory standard that made those policies, you see it now, and those policies are then reflect in the UCAS policies, and of course reflect in the laboratory policies or quality manual. The whole idea is to see that with this very structure put in place, irrespective of the country, there's going to be standard in that very laboratory. The overall aim of this thing is to continue to improve the experience of the service user, such as the patient, as required once again by the ISO laboratory standard. Now let us look at what are the types of the audit. So especially when we look at it mainly, I'm going to focus mainly on the internal audit. What are the types of audits? I know we've looked at internal audit, we have looked at external audit, and I've explained it already. So when we look at some type of audit, horizontal audit, vertical audit, witness or examination audit, and of course clinical audit. Now when you look at horizontal audit, in fact I'm going to try to differentiate horizontal from vertical for you first. Now when you look at audit, let me give you example that can help you to understand it when I define them. Now the laboratory is a complex setting, like we've already said. We have pre-analytical, we have analytical, we already said that. Now inside the laboratory, for example, we have specimen reception, we have maybe hematology, we have blood transfusion, we have biochemistry, whatever as the case may be. Now when there is an audit that takes place maybe of one process or one arm of that very laboratory, if audit is being conducted on one arm of that very laboratory, because laboratory is a complex setting like I've said, so when audit is being conducted on one arm or one of the arms of that very laboratory, or one of the sections of the laboratory, or one of the process of the laboratory, is then called horizontal audit. What do we mean by horizontal? Horizontal is just like this. What it means that you are conducting one thing across. So for example, you know what, I'm going to audit specimen reception, and you conduct specimen reception is not the entire laboratory, it's just one arm arm or one aspect of the laboratory. And when you are conducting audit only on specimen reception, that is then horizontal. So you can conduct audit about every aspect of the specimen reception, but not in other sessions. That is then called horizontal. Okay, so you are just picking one thing and going across the detail of that one thing. Now, that's also another way of looking at it. Let me also give you, I want to give you a lot of examples. Let me also give you another example. Now, when you work in the laboratory, and maybe, let me use hematology for example, and maybe there's a full blood count bench, there's a blood film morphology bench, of course, there's a coagulation bench. Now, when somebody starts assessing you, when there is audit only on the coagulation bench, somebody is being assessed against PT-RNR, APTT, or maybe D-dimer, every test under coagulation. Once there is one audit, because that member of staff is working in full blood count, is working in coagulation, is working in blood film morphology, is even working in blood bank, but you choose to assess that member of staff only on coagulation aspect of that very unit, that is also horizontal. So when you look at horizontal, you are picking one of the process, you are picking one of the session, you are picking one of the arm of that very activities or process, and you are assessing the detail of that very arm. So when you assess that particular arm, that is called horizontal. Now, when you look at the vertical, which is like this, what it means that you are assessing every arms of that very laboratory or that session. In other words, let's say you, in addition to specimen reception, you assess other departments like hematology, blood transfusion, biochemistry, histopathology. So one that is assessment in all these other sessions, that is called vertical. Again, if you bring it to individual who is working, let's say maybe in biochemistry, you are assessing the person on how to validate electrolyte or urea electrolyte creatinine, how to validate LFT, how to validate this or that, and all of that. When you assess an individual across everything the person is competent on, that can also be looking at vertical. But when you assess the person as at one thing out of many things the person is competent on, that is horizontal. Now let me also use full blood hematology again as an example. The person is competent in full blood count validation, coagulation, blood film morphology, in blood bank. When you assess the person against each of these very sessions, okay, that this person is competent on in that hematology and transfusion, is called vertical, because you are assessing every session that concern that very person. But when you assess only one session, like I've said, it is called horizontal. I hope I've tried to make this clear. So when you look at the horizontal, you are looking at one aspect, but mind you, that aspect you are looking at, there are sub things you are looking at in that one aspect. But when you look at vertical audit, you are looking at different sessions of something, and of course each of the session you look at the detail, the other session you look at the detail, and so on. So when you look at each different arms, you are looking at vertical audit. When you look at one of the arms or one of the sessions, like I've said, you are looking at horizontal audit. Now let me define it. In the horizontal audit is a process of maybe examining one process across the whole department that is being investigated. You can also look at the horizontal audit as auditing one element of process or more than one item. Now let me give you an example. So I've mentioned something like specimen reception. Okay, so maybe in that specimen reception, you decide to maybe look at the member of staff they have there, their qualification, their training. So you are just doing all of that only on specimen reception. That is horizontal. That same thing you are doing could have also been done in other departments. Now, when you do it in other departments as well, it then becomes vertical. I hope this makes sense. Now, what is then a vertical audit? When you look at the vertical audit, you are looking at when you are auditing all the process of the laboratory is called vertical audit. You can also look at vertical audit as auditing many processes or standard of the specimen of the processes. And what it then means that in that very audit, you are following it through, both from the pre-analytical to analytical to post-analytical. You see why it is a vertical. You are not picking one session, because that time you pick specimen reception, you are only picking pre-analytical. Even with the pre-analytical, you've not even exhaust all the whole pre-analytical, like maybe phlebotomy. You are just picking one pre-analytical session. When you pick that specimen reception, you are picking just pre-analytical. And when you examine or audit only that pre-analytical, that is horizontal audit, like I said. Or even when you audit analytical, but even in that analytical, you are looking at just one session. Okay, as a biomedical scientist, you are assessing the person only on coagulation or food blocker. That is horizontal. But when you assess across, irrespective of whether it is pre-analytical, analytical, or post-analytical, that is called vertical audit. I hope this makes sense. Now let us look at another type of audit, what we call a witness or examination audit. When you look at the witness or maybe examination audit, let me give you a good example. So I have been trained as a specialty biomedical scientist, which means I am competent to carry out a particular test. How would the laboratory ensure or determine that yes, what I have been trained for is actually what I'm doing? Is by doing internal audit. What it means that a member of staff will come and stay with me, maybe my senior member of staff like band 7 as the case may be, or the quality manager or training officer, whichever one. Someone will stay with me and then watch me work, watch me do those things that I'm competent to do, and the person will ask me question. That is witness or examination. So when the person asks me question or maybe watch me do what I'm doing, that is called examination or witness audit. Therefore, witness audit is a way of checking SOP suitability, is a way of making sure or determining that someone or a personnel or a member of staff is working as required in the standard operating procedure. And of course, why that is important, it can provide confidence to that very staff, because once the audit has completed and the person get a feedback, you've done well, that will provide confidence on that very member of staff. So this is also very, very important. Now, the next type of audit is what we call clinical audit. When we talk about clinical audit, well, this will lead us to what we call clinical governance. First of all, I would like to say that clinical audit can be defined as a quality improvement process that seeks to improve patient care and outcomes through systematic review of care against a documented criteria. In other words, when we look at the clinical audit, we're looking at the health care that is provided to the service user. Is it according to the standard or not? So if I'm to make it very simple, clinical audit can be defined as the process of providing a health care that is in line or that is according to the required standard. This therefore will then help to also let the service user and even the member of staff to know where they are doing well and where the areas that might need to improve. And that is where research comes in. So under clinical audit, you can see what we call research and evaluation, because they will continue to research. You know, when we talk about patient feedback or staff feedback, they all fall under this very clinical audit, because with the clinical audit, we can now be able to do research through evaluation and to see the shortcoming of that very laboratory and where the laboratory is doing well. That way we continue to improve. So in summary, clinical audit will look at the processes that involve in ensuring that the services that is provided to the service user reflect to the required criteria standard. So that is where we're going to stop. I hope I'll be able to explain audit, for you. So now I've also linked it to the clinical audit. The next video I'm going to look into a clinical audit in detail. So once again, thank you so much for listening. Can I also ask you to join the group if you want? If you click the join button of this very video, it can be able to take you to where you can be able to join the session or the group of any aspect of this very channel that you want. Whether you want me to prioritize your comment, or whether you want me to set up one-on-one meetings with you, or whether you want me to take you through a mock interview. Just look into it and see the one that best suits you. Please, can I ask you to like, share, and subscribe? Thank you very much till I come back your way again. Bye-bye.